Today, we're talking about endometriosis, a condition that affects millions of women worldwide, but often goes undiscussed. If you or someone you know struggles with painful periods, infertility, or ongoing inflammation, this video is for you. So, what exactly is endometriosis? It's a condition where tissue similar to the lining of the uterus, called the endometrium, starts to grow outside of the uterus. This extra tissue can attach itself to the ovaries, fallopian tubes, and other parts of the pelvic area. This tissue behaves like it would inside the uterus. It thickens, breaks down, and bleeds with each menstrual cycle. But because it's trapped, it causes pain, inflammation, and often leads to scarring and adhesions. Many people with endometriosis also experience fertility issues. One of the biggest indicators of endometriosis is pain, especially severe menstrual pain. But that's not the only symptom. Intense pain before and during menstruation, often extending to the lower back. Painful intercourse or discomfort afterward. Heavy menstrual bleeding or spotting between cycles. Digestive issues, such as bloating, constipation, and fatigue during periods. Endometriosis is also a leading cause of infertility, with over 30% of those affected having difficulty getting pregnant. If any of these symptoms sound familiar, know that you're not alone. It's important to recognize these symptoms and seek support. Now, let's dive into the potential causes. You might see that the exact cause is often labeled unknown. However, endometriosis is an estrogen-dominant condition, meaning it's highly sensitive to estrogen levels. Several theories suggest that high levels of estrogen, genetics, immune system dysfunction, and even retrograde menstruation could be factors. Retrograde menstruation occurs when menstrual blood flows backward into the pelvic cavity instead of leaving the body. If your mother or sister has endometriosis, you may be at higher risk. High levels of estrogen seem to promote endometrial growth. A weakened immune system may struggle to eliminate misplaced endometrial tissue. Let's talk about some natural ways to help balance estrogen and manage symptoms. These tips aren't a cure, but they can help make endometriosis more manageable. First, switch to an organic diet. Eating organic means avoiding the synthetic chemicals and pesticides and GMOs found in non-organic food. These chemicals often mimic estrogen in the body, which can increase estrogen levels. This is especially important with meats, dairy, and vegetables. And here's a quick tip. Reducing sugar. Sugar can increase estrogen production, so cutting down on sweets and refined carbs can make a difference. Second, add more cruciferous vegetables to your diet. These include kale, broccoli, Brussels sprouts, cauliflower, cabbage, and bok choy. Cruciferous vegetables help balance estrogen by increasing beneficial estrogen types while lowering harmful forms. If you want a concentrated option, consider DIM, a supplement derived from cruciferous vegetables. Just be sure to consult with your doctor before starting any new supplement. And third, iodine is incredibly helpful. It can actually reduce estrogen levels at the cellular level, which makes it useful for managing estrogen dominance. I recommend seek help as a natural source, but be sure to get it from a clean ocean source. Iodine is also great for conditions associated with estrogen dominance, like ovarian cysts and fibrocystic breast tissue. However, if you have hyperthyroidism, check with your doctor before taking iodine. Endometriosis can be hard to diagnose because its symptoms are similar to other conditions, like IBS or pelvic inflammatory disease. To diagnose it, your doctor will start by asking about your symptoms and family history. They might do a pelvic exam and recommend imaging tests like ultrasounds. In some cases, a procedure called laparoscopy is used to look for endometrial tissue inside the pelvic area. One of the most difficult aspects of endometriosis is its impact on fertility. It's one of the leading causes of infertility because the condition can create scar tissue, block fallopian tubes, and alter the environment in the pelvis. However, there is hope. Many women with endometriosis can still conceive, either naturally or with fertility treatments. Don't give up hope. With support and treatment, a healthy pregnancy is possible. There are also more conventional options that can help manage symptoms. For mild pain, over-the-counter pain relievers may work, but for severe pain, your doctor might prescribe something stronger. Hormonal treatments can reduce or eliminate menstruation, which may help slow down endometrial growth. In severe cases, surgery may be recommended to remove as much endometrial tissue as possible. Regular exercise, a balanced diet, and stress management can also play a role in symptom management. While these won't cure endometriosis, they can help you feel better and improve your overall quality of life. Living with endometriosis is challenging and often impacts many areas of life, from work to relationships. But remember, you don't have to go through it alone. Seek support from healthcare providers, support groups, and loved ones. Connecting with others who understand what you're going through can make a world of difference. The good news: researchers are hard at work trying to understand endometriosis better. With new studies and treatments, we're moving closer to more effective options and hopefully a cure. Until then, there's hope, there's support, and there's a growing understanding of this condition. Thank you for watching and joining us in shedding light on endometriosis. If you found this video helpful, please like, subscribe, and share it with others to spread awareness. We're here to support each other in finding better health and understanding. Together, let's break the silence around endometriosis.